you still doing numbers updates though?
Yes,
Yeah.
numbers updates will go out at the very least Saturday, I believe Sunday as well. Check right now, actually. As you could guess, I'm not going back to Ormond Park for Easter.
Yeah, we aren't either.
Yeah.
So, although we don't usually, because Jim's tied up with church stuff.
Oh.
So even with empty churches, they're
Still doing
they're doing live stream.
Well, I'm sure. I mean, that's the other thing. It's like,
Zooming with my manager. That's gonna do it here. Just talk, I guess. My daughter's a high school for creating, so she's been doing a lot of schoolwork. That's what Zoom would be great for right social groups and yeah.
Start on it.
Oh yeah.
How to manage
Right. It's a Friday.
It's good. It is, but it just doesn't feel like a Friday.
Yeah.
Yeah, been going through that for a while.
It just one long day. Goose on it.
Yeah, they do that actually much better. And I think that's
Was this still at the plus 90 degrees out?
well, that's the big thing we're talking about.
Hey,
That
Pat,
time, I don't know.
is there a Wi-Fi plug in?
Yes.
And it is, so
You know it. Kevin, do you know the one?
yeah, how long it's
every day. You're not just covering the street, you're living in a store.
Yeah.
So you don't have water or.
That's okay.
Yeah.
It was about 2, because you know, the big story was we didn't have water.
Right.
When that happened, that was, what, 17 days or something? Yeah.
Yeah.
Plus 3 weeks.
Yeah.
So we were doing storage, you know, how do you flush a toilet when you don't have water?
Look at the water in the tub.
Yeah. So, I wash your hands, it was just weird. And then plus the water's all cut off because, you know.
Got you, Caroline.
Couldn't get over bridges and things.
Right.
So, everything about it was.
Yeah. Second longest one.
Really, pretty much, yeah.
yeah, I don't know. I wish I knew.
Yeah, no, I've been impacted the side.
Right.
Across the board. The segments of society, in the last 20 years.
Right. Already did.
Your way.
Sanitize. Check
Kathy, you connected, you get internet?
Yep, we're good. Thanks.
all already.
Do you want me to text you the password?
No, I'm good, I'm on my hotspot.
I didn't do these stairs.
We'll take our chances.
Everything down here is,
Trust me, this room's never been.
it's clean. I did notice your screen back. You really need to clean your screen, dude.
Mine?
Yeah.
One day at a time.
It's gnarly.
It's not.
We're live.
Yeah.
Who's that, 0763?
Yeah.
Just check.
Trump, let's Trump do that.
I'm not
Thanks,
sure.
Rob.
I tend to be a driving here, so. I never go to the
I'm doing good. How are you doing?
I know.
Oh, yeah. It's been,
Who is
days are
that, 676?
weeks before, because I was so busy.
Hi, this is Beth Maliki from KCRG.
You know, working at home is getting
Thanks,
old.
You change the season.
Yes, yeah, so it was kind of fun to come up here.
They just
and-
went hot.
Yeah, it's already.
Okay.
Yeah.
Okay, everything is hot to the world.
I did tell my husband I would stop and make up lunch.
Everything's hot to the world.
Okay.
See you. Things scared you though.
Couple new people on the line
Hey,
here.
Andrew.
We're gonna run through some numbers.
I
5250.
want you to stand behind the podium.
Eric Van Sickle, Waverly
By
Newspaper.
the governor's height.
No.
Tell us everything's so pretty tall.
Yeah, just
Pretty
get your
tall.
critical focus with this.
Well, bend your knees just a little, judge them.
Hey, who's that?
I'm just basically.
8684.
Yeah.
That's Jared Strong at the Times Herald in Carroll.
Got it, thank you.
Yep.
Who's at 3533?
This is Nick Coltrane with the Register.
Got it.
Okay. Hey, Andrew? Yeah. Would you, I'd like to have you go back to the podium, just do a quick mic check. I just found that. I'm not happy.
Okay.
Here it comes.
Podium mic check, 1, 2, 3. Podium mic, 1, 2, 3. Good.
I can hear you. Oh, well, that's nice. That's fine.
Stevie Joyce from Bloomberg.
And you're at the 202 area code, right? 8052, last four numbers.
Correct.
Got it. Who's at 7637?
Rachel with WOI.
Thank you.
Who just called in at 5086?
Dave Price.
Hey, Josh. Yeah, hey, when's my clock start my return? Katie is the third one. I don't have that, all I have is, Governor Kim Reynolds, precedent, 4/10/2020.
Hello, this is Jason Clay with the Register.
Jason, you're at 3237, right?
Thank you.
That's great, yep, thank you.
That's fine, thank you. I was just checking to make sure we didn't have a problem.
Good morning. We'll go ahead and start with an update on the numbers. Today, we have 118 new positive cases for a total of 1,388 positive. We have 2 new counties, Osceola and Union, for a total of 81 counties. We have 862 negative cases today for a total of 14,565 negative. The State Hygienic Lab has 1,974 tests available. As of last evening, we have 119 hospitalized, 506 recovered for a recovery rate of 36%. And I'm very sad to report that we have had an additional 2 deaths, 1 older and 1 elderly adult, both in Lynn County, for a total of 31 deaths. Over the course of the last month, we have implemented significant mitigation strategies aimed at slowing the spread of COVID-19 across our state, including closing businesses and schools. And while these steps are necessary at this critical time, it's important not to overlook the unintended consequences that they have on Iowa families. More than 354,000 Iowans are already facing food insecurity, and now these families and others may be dealing with the recent loss of jobs, children out of school, and trouble making ends meet. Iowa's 6 Feeding America food banks and their 1,200 community partners across the state provided 38 million meals to Iowans in need last year. And while COVID-19 pandemic is unlike anything we've ever experienced, they remained committed to feeding even more Iowa families during these challenging times. In March alone, Iowa food pantries helped 65% more Iowans with applications for food assistance than this time last year. But as the number of food insecure Iowans increases, so does demand on our food banks and pantries. With restaurants open for carry-out and delivery, food donations are down, and less food is being rescued from grocery stores to stock food pantries. To help meet this challenge, I have created the Feeding Iowans Task Force, and I have asked the Lieutenant Governor Gregg, to lead this effort. He will be joined with individuals from the Iowa Food Bank, members of my team, and representatives from the Department of Agriculture, Homeland Security Emergency Management, the Department of Public Health, Department of Human Services, Department of Ed, Department of Aging, and of course Volunteer Iowa. I've charged the task force with raising awareness of hunger-related issues, identifying potential gaps in the system, connecting resources to ensure that Iowans have food on their tables, and making sure that Iowans know where to go to get help. If you're in immediate need of food, please go to your nearest food bank or food pantry, or go to coronavirus.iowa.gov for food assistance information, where you'll find links to programs from the Department of Human Services, Department of Public Health, Education, Aging, and other state agencies. Thanks to funding through the CARES Act, food banks and most state programs will receive additional resources that will allow more flexibility in delivering services and expanding eligibility. Everyday Iowans can also lend a hand. Food banks, pantries, emergency meal sites, and shelters need volunteers. Nearly 40% of the volunteer force that keeps food banks operating is made up of older adults, who are, of course, at most risk and need to stay home, and they're doing as they should to protect their health. Volunteer Iowa has launched COVID-19 volunteer portal that includes more than 75 postings of high-need volunteer opportunities across Iowa. So if you're healthy, low risk, and do not live with anyone who is ill or at high risk, please consider volunteering to assist the meal packing and distribution at your local food bank or pantry. And again, you can find more information about that at coronavirus.iowa.gov. Finally, I want to take just a moment to thank the organizations and businesses who have stepped up to contribute generously to this important cause. Iowa is a state that feeds the world, so it's no wonder that Iowans answered the call to feed their own when the need arises. Thank you to the following for their donations to food banks and meal programs across the state of Iowa. Iowa pork producers have donated 12,000 pounds of pork. Iowa Beef Council, 5,500 beef sticks. AE Dairy is donating milk for distribution through our Des Moines Public Schools. Tyson Foods has donated 200,000 pounds of products equaling 8 million meals. Iowa egg farmers continue their commitment to providing 35,000 dozen eggs each month. Smithville Foods, 27,000 pounds of pork processed and packaged by Midwest Premier. Lynch Livestock Companies have donated 30,000 pounds of pork, and the Lynch Family Foundation and Premium Iowa Pork will be donating 250,000 pounds of pork over the next 6 months. I also want to thank Corteva Agri Science for the 100,000 matching donation to assist food banks of Iowa, the Iowa Farm Bureau Foundation for their 100,000 donation to the Iowa Food Bank Association, and Mid-America Energy, whose foundation has contributed or donated 500,000 to support Iowa food insecurity relief at this time. You are making a difference in the lives of Iowans at a time when it is much needed, and I just want to say again, thank you for your generous support. As we end the week, I wanted to provide another look at the data for RMCC regions 1, 5, and 6, where COVID-19 has had the most impact in our state. At the RMCC region, which includes the Des Moines metro area, they had 30 COVID patients hospitalized yesterday. 1 new patient was admitted in the last 24 hours. 8 were in ICUs, and 6 were on ventilators. Other resources available for patient care included 1,338 inpatient beds. We have available in that region 157 ICU beds and 218 ventilators. In Region 5, where Johnson County and Scott County is located, there were 39 COVID-19 patients hospitalized yesterday. 12 new patients were admitted in the last 24 hours. 14 were in ICUs, and 6 were on ventilators. There were 675 inpatient beds available, 79 ICU beds, and 156 ventilators. In Region 6, which includes Lynn County, and yesterday there were 49 COVID-19 patients hospitalized. 3 new patients were admitted in the last 24 hours. 27 were in ICU, and 16 were on ventilators. They have the availability for 1,170 inpatient beds, 78 ICU beds, and 127 ventilators available for patient care. While our hospital capacity and resources look good, one issue that continues to be a challenge in Iowa and across the country is a shortage of PPE. The Department of Public Health has issued guidance on PPE usage over the last several weeks, and today they are taking additional steps to preserve PPE supply during this time. And I've asked Sarah Reister to provide more information about that. Sarah?
Thank you, Governor Reynolds. I want to talk this morning about an order our medical director is issuing effective today related to current and anticipated shortages of personal protective equipment, or PPE. First, I want to thank the many Iowans who have donated PPE and our incredible manufacturers who are ramping up production as the global community uses more PPE than ever before to protect healthcare workers and patients. Unfortunately, we're in a position where, like many states and countries across the globe, we are preparing for a time when we might not have enough of these supplies. On April 2nd, as the governor mentioned, our department issued guidance for face mask and respirator extended use or reuse in times of crisis. Today, we are taking the additional step of issuing a PPE shortage order. The order requires all providers to work with our department to further assess, monitor, and extend the use of the supply of PPE in our state, and is based on guidance that has been provided by the CDC. The order applies to healthcare providers, hospitals, healthcare facilities, clinics, local public health agencies, medical and response organizations, and any others that use PPE for the treatment of patients or residents of facilities. The order requires these entities to decrease demand for PPE by minimizing patient contacts when possible, and maximizing the way barriers and ventilation systems are used. Complying with a ban on non-essential medical and dental services. This was ordered by Governor Reynolds last month and is included in this order by way of reminder. It requires canceling all other elective and non-urgent procedures and appointments, reserving PPE for healthcare provision, and having patients cover their mouth and nose with a barrier other than a surgical face mask. And finally, using telemedicine whenever possible. The second part of the directive is focused on extending the use of PPE when the demand for PPE exceeds supply. If facilities are using all of the measures I just mentioned and the PPE demand is still exceeding available supply, the order directs them to use face masks that may be beyond their shelf life or expiration date, not change face masks or respirators for each patient encounter, use washable gowns, use reusable eye protection, decrease the length of stay for COVID-19 patients if they're medically stable. And the third step in the order, if PPE use continues to outpace supply, is to implement crisis capacity standards. And this would include reusing PPE and provides guidance for removal and reuse, using PPE past its shelf life, prioritizing face masks for essential activities that may involve direct infectious contacts, and considering alternative approaches such as using homemade masks in combination with face shields. This PPE shortage order also provides immunity protection for providers who need to implement these strategies related to this unprecedented response while they continue to provide medical care and assistance and while they're acting in good faith. We understand the issuance of this order may be unsettling, but due to the global shortage of PPE supply, we've determined that now is the time to take this action. I again want to thank our healthcare workforce and other providers who are on the front lines delivering healthcare services in facilities, as well as in Iowans' homes, as well as thank PPE manufacturers and the many Iowans who are dedicating their time to making homemade masks and face shields for the time when use of those might become necessary. And finally, one other reason for issuing the PPE shortage order is to increase awareness across the state as different parts of our state are experiencing different challenges, and as we all continue to work together to maximize resources so we can continue to take care of all Iowans. Please visit the IDPH webpage for more details, including guidance for making homemade masks and using face coverings when in public. Thank you, Governor.
Thank you, Sarah. I appreciate that. So when we started this week, I told Iowans that it could be a difficult one, and it has been, as we've watched our numbers of positive cases and deaths continue to increase. But we have also had some reassuring signs as well. We are seeing our recovery rate increase and our curve begin to flatten, and which are early indicators that we are doing the right things. But our work is not yet done. As I have now for more than a month, I am asking Iowans to continue to do your part to slow the spread of the virus. Your efforts, they are making a difference. So please continue to stay home if you can, leave only for essential errands, practice social distancing. We know it works. Don't gather in groups of more than 10. And if you have a member of your family that is sick or you are sick, isolate at home. And if we continue to take these simple steps seriously, we will get through this sooner rather than later. And with that, we'll open it up for questions.
Governor, I don't know if you can answer, maybe Sarah, already so many healthcare workers have come down with this virus, and now the threat could be that they have to reuse gear that maybe won't protect them as well. That's got to be a concern, I would imagine, for them and for you trying to help them.
Yeah, and you can talk about the percentages in just a second. I know about 20% of healthcare, but that's similar to other household percentages, so that's similar when you're in confined efforts like that. But, it has been a concern all along, and that's why we have implemented the mitigation efforts that we have, not only protect older Iowans and to bend and slow the spread and flatten the curve to prevent overwhelming our healthcare system, but most importantly, too, to protect, our healthcare workers, our first responders, those individuals that are on the front lines. And so, we're continuing to do everything we can to make sure that we can provide them the PPE that they need. But in the event that they can't, these are some of the steps that we have to step through. Do you have anything to add to that, Sarah?
I think the only thing I would add is that is why the mitigation efforts that we've been consistently recommending all along continue to be so important. To stay home when you can, to social distance when you are out, because we are concerned about our healthcare providers. They're on the front lines. They're doing this every day. We are doing everything we can as a state to procure additional PPE so that we can continue to send those supplies out to people. We understand that people are scared, and so we continue to do everything we can to find supply wherever we can. We will continue to distribute that to the areas of highest need. But we really felt like now is the time to issue this shortage order. We think that we know that facilities are already doing some of the extended use guidelines because there has been a shortage. And so this was important for us to take this additional step today.
Are you finding it more difficult at this point to get in new supplies of PPE, especially now that the national stockpile is down to nothing?
We've seen it all along. We were receiving some orders, but as we continue to see those pushed back, we've had to reach within the state to see what else we could do to help to provide our healthcare workers and those first responders the PPE that they need. Just for example, so like the Department of Corrections, I've talked about that a lot, but to date they've made 2,800 gowns, and they are doubling their production rate, and they'll be able to go to 1,000 a day. And this is critical for our long-term care providers because they provide the protection, but they're washable. We have more and more businesses every day that are being able to provide the face shields. And when we can have a face shield, if I'm saying anything that I shouldn't, you step right in. When they have the face shield, then the homemade mask, then we can start to use some of them, and they are washable. And then there's businesses in other states where they actually can take the used N95 mask and clean them and bring them back too. So there's things that, Kathy, that we're looking at all the time to continue to address what we know is not only an Iowa shortage but a national shortage. And while we are so impressed with how people have stepped up to help, and businesses and individuals, it is just a constant effort. And we have, hospitals are ordering through their distributors, so they're ordering independently. DAS is ordering, Homeland Security is ordering, our local public health officials are gathering information and putting the orders in. So we continue to say over and over, it's an all of the above approach. So we're looking at every available opportunity to bring PPE into the state. Do you have anything to add to that? Okay.
You mentioned unintended consequences of social distancing, and you've also said you're concerned about Iowans' mental health.
Yeah.
Is there any way to measure whether Iowans are having issues more than they were before?
Yeah.
What can be done about that? And finally, looking forward, if the legislature is unable to come back and approve more money for mental health, what's your fallback?
Yeah. Well, we know that. We're going to have Director Garcia come next week, and we're going to provide a little bit more information on this. I haven't had a chance to read through all of it. Iowa State just did a white paper that actually addresses some of the concerns that isolation and the COVID-19 pandemic is having on Iowans. Just to talk about some of the numbers, whether it's just the mental well-being of Iowans, the isolation, the domestic abuse is something that we're watching very closely. The well-being of children, that just they don't have the eyes on them like they typically do when they're in school. And so, we're trying to figure out ways that we can address that. But that is something we have to balance too through all of this and figure out how we can meet those needs as well. So we're gonna next week we'll have some more data and more resources and talk about how we are proactively doing the best job that we can to address those extreme extremely critical issues as well. There's a commitment from this legislature to make sure that we have the funding there. They have unanimously supported adult mental health reform, unanimously almost supported the children's mental health reform, and we know that we have an obligation to be able to fund the services that we've put together. So when I talked to both parties before we suspended the legislature, there was a commitment to make sure that we got something done there. And so we'll have to do it in a responsible manner, but there is the commitment there, I believe, to follow through and make sure that we can provide the funding for the resources, because to your point, there potentially could be, an uptick there, and maybe some of the block granting and funding that I would hope, and I assume that it does, and then through the disaster declaration, we've also asked for some funding through that too when we get the individual assistance. And so again, we're looking at every possible opportunity to be ready and to address some of those very critical issues as well.
Governor, do you have the ratings yet for the regions? Have those been updated at all?
Yeah.
Yeah, I don't think there's been a change since yesterday. Right. So we still have Region 5 is at a 9, Region 6 is at an 8, Region 2 is at a 7, Region 1 is at an 8, Region 3 is at a 6, and Region 4 is at a 6.
And yesterday when you were talking about, we're seeing maybe a little bit of a flattening. We got a lot of emails talking about, what do you base that optimism on, considering we're still getting an uptick in our, emissions and deaths and numbers. So is there a way to describe that and how that, you come up with that?
Yeah, so an epi curve helps us examine case data by time, which is part of the way we organize epidemiological information in addition to information about the person, age, gender, and place that the infection occurred. It gives us insight into things like the time trend of the outbreak, which is the distribution of cases over time, outliers or cases that stand apart from the overall pattern, a general sense of the outbreak's magnitude, and inferences about the outbreak's pattern of spread, the most likely time of exposure. And so what we have been looking at is we've been looking at onset of symptoms data. So while, the positive case results, and we have said all along that we anticipated last week was going to be a difficult week in terms of cases. Again, at the beginning of this week, we said we fully expected to see our case numbers start to climb. But when we look at our onset of symptoms data, that appears to be flattening. And that's really the whole goal of public health mitigation efforts, is to see a flattening so that we have kind of a flat plateau of illness and infection. And the ideal goal would be to avoid ever really seeing a peak and a spike in cases. And so that's what I was referencing, is we're looking at the epi curve related to onset of symptoms, and that curve appears to be looking fairly flat at this particular point in time, which is why it is so important for the public to continue to do all of the things that they have been doing. And we know it's hard, and we know we're asking a lot, but we need people to continue to stay at home, leave only for essentials. If you're mildly ill, stay home, call ahead to your doctor's office first. If we can continue to slow the spread of the infection in our state until we have a vaccine or we have some way to make sure that other people aren't going to get it, that we're not going to pass it to each other, all of these public health mitigation efforts that we've asked people to do, they are important, and we're seeing the evidence that it's starting to work. And so we would just renew our plea to Iowans to keep doing all of the wonderful things and the hard things that you have been doing so that we can protect our loved ones. Thank you.
We had a quick request for an update on the COVID cases among the incarcerated population. I don't know if you have any kind of
I'm not
update
aware of
on
any.
that.
Yeah. Kathy, I'm not aware of any at this time, but they were very proactive in really putting in place a lot of the same mitigation efforts that our long-term care facilities did, because we knew that it would be problematic. I'm also going to have Director Skinner come next week and be part of the press conference, not only with the number of PPE supplies that they're making available for our hospitals and long-term care facilities across the state and our state facilities, but she can talk about some of the mitigation efforts that she put in place to really help get in front of that.
All right, Rod with the Cedar Rapids Gazette, go ahead.
Yes, just to clarify, you're saying the curve is flattening, but does today's order mean you expect a surge that's going to create a shortage problem that will tax our healthcare system like other parts of the country have experienced? And if that's the case, how long do you think this PPE shortage will exist in Iowa?
Today's order isn't a reflection of an increased spike in cases. Today's order is an acknowledgement that PPE supplies are low globally, as well as in the United States. And so the order gives guidance and directives to healthcare providers to the extent that they can't get the PPE that they would normally use to provide the standard of care that they normally provide. And so it gives them instructions for what to do in the event that they can't get PPE. You know, PPE is used for a whole bunch of medical procedures. It's used all of the time for elective procedures, and lots of patient encounters utilize PPE. And so it's not a reflection of an anticipated peak or spike or anything like that. It's a reflection of the fact that supplies are low, additional PPE is hard to find, and so it gives healthcare providers instructions about what to do if they can't find the PPE or they can't acquire the PPE that they need. It doesn't mean that the state's going to slow down our efforts or our manufacturing or anything. We're going to continue to do everything we can to get PPE to our healthcare providers, but it provides them some instructions about what to do in the event that they can't get the supplies that they need, as well as some immunity protections when they care for patients if they do get to that point.
Beth with KCRG, go ahead.
Thank you so much. Governor, with the testing becoming more available at the state hygienic lab and with most providers still using that framework, does the IDPH anticipate expanding that framework so different people, more people can have access to the COVID-19 test?
Yeah. They have.
Yeah, thank you. I mean, yes. And the answer to that is yes. As additional testing supplies come online, the health department has continued to broaden the scope of people that can receive testing at SHL. As a reminder, though, clinicians have access to national reference laboratories as well, and they can always use their clinical discretion to order a test for patients if they want to do that. But yes, as additional testing supplies become available at the state hygienic lab, we do intend to continue to broaden those categories so more people can be tested.
And we're actually seeing the numbers increase all the time through the other options. We're seeing significant increase of testing capacity with hospitals or through the clinicians, through the other labs, the national labs. So we are continuing to see those numbers increase daily.
Iowa Public Radio, go ahead.
Hey, I just kind of want to build off that question to say if you're planning to change testing guidelines to include, testing people, healthcare workers, and people who live in assisted living facilities that don't have symptoms, which currently isn't a rule.
Yeah, I mean, you want to take that one? Sorry.
I mean, I think that what we would look at is additional opportunities to provide testing for people, like you mentioned, in a long-term care facility where you have congregate living spaces and where there's a concern that should the virus get introduced into those spaces that it would spread quickly. So I think, certainly thinking about long-term care, which always has been, one of our concerns, we would certainly consider that. In terms of testing asymptomatic people, I mean, one of the things I think we all have to remember about testing is because you have a negative test today doesn't necessarily mean you're going to have a negative test tomorrow, which is why all of the mitigation efforts that we've identified and that we continue to ask people to follow are so incredibly important. But I would really defer to Dr. Padati about what that looks like in terms of the goal for expansion. But certainly we would be focused on long-term care facilities and other congregate living type situations.
Caroline Cummings, go ahead.
Good morning, Governor. Sarah, this is a question for you. How can the state confidently say that the curve is flattening? I know you explained a little bit of the epi curve, and someone in your office explained it to me yesterday what you're looking at, but how can you confidently say the curve is flattening when infectious disease doctors are disputing that, and also when we don't have mass testing? and there's certainly cases that are going undetected, how can we really say that things are taking a turn for the better?
Thank you, Caroline. So what I can tell you is when we look at our onset of symptoms data, the curve looks like this, and then it starts to plateau. And so that's what we're looking for, as opposed to onset of symptoms that just continues to climb, continues to climb, continues to climb. I understand your point about testing and you know, how do you know if you aren't testing everybody? That's been a challenge not only in Iowa, but it's been a challenge in other states as well. And so what I'm conveying is that we have not continued to see, despite our limited testing, we have not continued to see a tick up in terms of the date of the onset of symptoms. That curve is appearing to be flat. Now, as we do get increased testing, we might see more cases, and I think that's the point that's been made, is that, and we've anticipated all along, that we would continue to see more cases this week. But when we look back at onset of symptoms, the curve is, you know, kind of plateauing, and that's something that we would be willing to share so that people can see what that looks like. I think that I answered the question. Okay.
Thank you. And we're looking at that maybe next week. We'll give them a little preview, right? We're hoping to be able to provide that for the public. So we want to try to be as transparent so you can see what they're looking at and what they're measuring. And so we hope to have that available next week with the other RMCC information that we're tracking.
We're taking 2 more questions. Jason in the register.
Good morning, Governor. Some states, for example, Minnesota, is publishing the names of senior care facilities with even a single coronavirus case. Considering how easily this disease is spread, the enhanced vulnerability of senior citizens, and the limited testing that's available, have you considered adopting Minnesota's more stringent reporting method? I guess the real question here is why wait until there is an outbreak of 3 or more cases at a single care facility before alerting the public?
Do you want to? Yep.
Hi, Jason. So an outbreak, we consider an outbreak to be an increase above baseline. And so as we've seen with COVID-19, cases can be associated with a variety of risk factors, including things like travel or contact with a known case or community spread. Using 3 cases among residents allows us to be confident that we have confirmed that the outbreak is associated with a facility rather than detecting cases associated with another potential risk factor or source.
All right, Dave Price, last question.
Good morning, Governor and Sarah. Governor, when you talked about the potential PPE shortage, we've been getting emails from viewers the last couple of weeks saying that their businesses are still open, they have to go to work, and particularly the ones with some kind of underlying health condition, and they do not have the proper PPE protection in their mind, so what are they supposed to do? And then secondarily, if you have only recently mandated that hospitals provide the Department of Public Health with this necessary health information about what's going on, and you've been forecasting based on incomplete information, then doesn't that potentially give a misguided or inaccurate portrayal of what's going on?
No. So first of all, I'll let maybe Sarah take that last question and talk about what we've done. They've issued guidance all along. This has been something we've been talking about since day one and trying to work with our healthcare providers and individuals across the state. This is the one time I don't have that 800 number written on the piece of paper in front of me, so we will make sure, but if you go to coronavirus.iowa.gov, I'm sure that 800 number will be there for individuals that have questions. We actually have a team that's set up and volunteered to be a resource for individuals that have those concerns. So I would encourage anybody that's raised that with you, then provide that information for them or help us elevate that so that they can get their questions answered. I'm not sure what he's asking.
So, Dave, in terms of your question about guidance for people that have to continue to go to work, we have issued guidance for businesses, and we have given recommendations about screening workforce before they report to work to make sure that they don't have a fever or they don't have any other symptoms, and recommending exclusion of those individuals from the workplace. We've also recommended, staggering shifts if possible, trying to implement social distancing within the work environment to the extent possible. And when people can't do that, those would be the times in which the individual employees might consider wearing a mask at work. Now, the PPE shortage is real, as I said, so businesses might have a hard time obtaining PPE supplies for their employees, and those would be the situations in which individuals who are concerned might consider wearing a homemade mask in the work environment.
Okay. Thank you. Thank you.
Right. The cleaner. It's good, I think. I don't know what it was we had for like 2 minutes. Caroline Cummings, I think, couldn't hear what was going on from. So I don't know if it was maybe something on her end with her phone or.
Nobody else was.
Nobody else. I started texting folks because like they're all supposed to text me the second there's an issue. Caroline texted me, but I was texting Rachel. She was fine. Dave Price was fine.
It's I would think it'd be on her end.
Because
what was the deal? Did you say the line was locked?
Yeah, that's not good.
So what happened was she couldn't hear the gov for like 2 minutes and it came back on. She never disconnected from the call or anything.
Yeah.
I might just call her and see exactly what happened.
Yeah, I mean, if she thinks it's not her system,